Hi, everyone. Welcome back. Hopefully you got a chance to stretch your legs, grab a cup of coffee, grab a tea, grab a snack, whatever that is, and get a mini break. And I also hope you had a chance to enjoy one of the many breakout sessions. As you all saw, there were lots of interesting topics there. We have 10 themes. It's kind of rapid fire, 30-minute conversations. And then I will say that those same 10 themes will be available on Thursday. So if you missed something today that you wanted to pop into and have a conversation about with some random participants or some people come back on Thursday. Those same 10 themes will be here. We actually have a special edition 11th theme that we're featuring on Thursday too. So keep an eye out on your email tomorrow. That will come for us with a new video and a new theme for Thursday. But enough about the breakout sessions. It looks like we've got folks joining us back here on the live stage. So we're going to get right back into our main agenda programming. And I am, again, thrilled for this next panel that we have. If you all tuned in and we're here for our first session this morning, we are asking really big questions and really big topics, and they're really complicated. And we have wonderful guests here who are going to try to unpack these questions that we've been asking them to unpack and take them in a wonderful variety of directions. So hopefully you are enjoying that journey and this conversation of wherever it may lead. And so today, for the next hour, we're going to have a panel where we're now talking about the lessons this past year has brought to our understanding about science, trust, human nature, and its role in policy. And I am pleased to have three very distinguished, lovely people joining me this afternoon, where I won't be here, I'll be gone in a minute. But the first up is Jandel Allen-Davis. She is president and CEO of Craig Hospital here in Denver, Colorado, where I am based. She's a world-renowned rehabilitation hospital. Dr. Allen-Davis believes that healthcare will improve when all the primary stakeholder groups, including clinicians, patients, elected officials, community leaders, and employers, can collaborate effectively to put the patient at the center. She is also an advisor to the Institute for Science and Policy, and she really helps us think critically about many of the questions that we're going to be talking about today and provides us with some great leadership. So I'm such a joy to have gotten to know Jandel recently, and so happy that she's joining us today. We also have Dan Sarewitz, who is the co-director of the Consortium for Science, Policy, and Outcomes at Arizona State University, and he directs their office in Washington, D.C. His work focuses on revealing the connections between science, policy decisions, scientific research, and social outcomes. He also edits the great magazine Issues of Science and Technology. If you haven't checked it out, you can find a link on that virtual bookshelf I was mentioning earlier. It's on our main Institute Symposium website. And I will have to say that I have been a big fan of Dan Sarewitz's work and teachings and writings for many, many years. So I'm really excited that he has chosen to spend today with us. And last but definitely not least is this wonderful voice and now face that we all get to see, which is Corey Flintoff. He is a retired international correspondent for National Public Radio and the former bureau chief in Moscow. His journalism career is very extensive and has taken him to more than 50 countries, where he's covered everything from the civil war in Libya to the earthquake in Haiti to the Arab Spring, among many other global, really important topics. He has a very unique perspective on journalism, government, and human nature, and he is going to be both part of our inspiration to this panel and conversation and also our host to get us through this next hour. So I'm very pleased to have these three guests joining us today, and I'm going to turn this over to Corey to kind of get us started. Hope you enjoy.
Great. Thank you, Kristen, and good morning, everyone. We talked a little bit, we've been talking over the past week a little bit about what we were going to, how we were going to set up this conversation, and everybody showed an inclination, I think, to sort of just challenge the question. So I'm looking forward to doing that. And I want to address this first question, first to you, Jandel, and that is, we're told that trust in American institutions, and we're talking about the courts, we're talking about the medical system, the financial system, the political system, is just steadily eroding over the past decade, really, several decades. And the first thing I wanted to do is challenge that question is, do you think that's true? And to the degree that it might be true, is it good or bad?
Yeah, well, thanks for the opportunity, Corey, to jump right in. answer this question. And, interestingly, I say I do believe it's true. And as often happens with good or bad, those sort of binary things, that it depends. I think there's a good side to and maybe not so much good as a logical or a predictable side to why our sense of trust, if that's the appropriate word to use, can change over time. But then there also are some bad. So what I do is say, with respect to the good side, or why it's not necessarily the, sort of the end of the world, it's because systems evolve. Our thinking evolves. The idea of social context, social constructs change over time. And so in that sense, what is seemingly good or seemingly relevant, seemingly trustworthy now may not be at any given time. And so we have to kind of keep ourselves grounded in what is important from the perspective of context. So in short, the good part, I think, is that context matters, so we have to do it. But what can be difficult, I think, is the ability to figure out how do you cut through the noise and clutter that might be around you at any given time to try to discern what is still good and what is still, I'd say, sort of the touchstones or the foundation of what makes societies and communities work. And so the bad part, in my view, is that what we can find ourselves lacking at any given time across in history, and certainly in a weird way, ironic way in some ways, we're no different today, is where do you find the credible sources? Where are the credible sources of really good information that allow us, because we are parts of complex adaptive systems, basically. We're always changing and always having to adapt to changes around us. Where do we find the credible information that enables us to sort of discern, distinguish, critically think about, analyze, and then form opinions that allow us to sort of navigate what might be going on at any given time? And so when we don't have that, I think our good old amygdala can easily get hijacked, part of our brain that sort of drives fight or flight in some ways, and we can find ourselves pretty quickly hijacked if we can't get our hands on credible, good sources of information. And can begin to see danger and threat or opportunities for mischief all around us. And that then drives a sense that systems and people and institutions and communities can't be trusted. And so, you add to that the notions of power imbalances, because power is and imbalances are. And it can become pretty quickly, you can find yourself in a state of disequilibrium. So I'd say it's both. It is, maybe you could say good, but the changes and sort of shifting nature of trust is. And
sorry, I was briefly offline there.
Oh, okay. Well, I'm done.
If we can pick up where we left off, I'm going to actually go to Dan to ask you the same question. Has trust really been eroding in all these systems? And is that necessarily a good thing or a bad thing?
So let me first just go back to something Kristen said at the beginning, which is we're going after big, complex questions, and which is great. So that also means the answers are going to be filled with ambiguities and uncertainties themselves. So I think the key thing is to explore what's at stake here, and which Jandel has gotten us off on exactly the right foot in doing. So is trust in American institutions, is it steadily eroding? Well, I think, many of us certainly have the sense that it is, but I'm also reminded of the sort of standard trope about what Americans think about Congress. They hate Congress, but they love their member of Congress. Mm. And I think if you look at individual behavior, there's lots of reasons to think that people are still dependent on and trusting of many institutions. If you look at public opinion surveys about who people trust most, doctors and scientists are near the top of the list. Members of Congress and journalists, sorry, Corey, are near the bottom of the list. And those are kind of long-term patterns. I think the question of how the undeniable kind of political polarization that's so I guess I'd say virulent in this country now maps onto trust in institutions is maybe part of the way we need to think about it. If you If you see yourself as part of a beleaguered tribe opposed by the other side, you're not going to trust what they have to say, and you're not going to trust the institutions that you associate with them. So, so I think we're certainly seeing a lot of that, and it's and we've certainly seen a lot of it around around COVID for reasons that maybe ended up being surprising to some of us. So it's a real phenomenon, it seems to me, but it also seems to me it's not easily separated from the question of political polarization that's so deep in our country. And what, to me, what makes it weird and notable in terms of COVID is you would have thought that a society-wide sort of almost existential challenge like a pandemic would have brought us together, would have given us reason to have a shared sense of confidence in leadership and in institutions, and it seems not to have done that. And that may be something that we want to talk about a bit about as we proceed here, Corey. So, but I think that the fact that it hasn't really brought us together in a way that we might have expected, that I expected 8 months or 9 months ago, I think maybe does speak to this question of eroding trust.
Corey, can you hear us? So I think Corey's working on his audio right now. I do see him. But Corey, you with us? All right, I'm gonna let our tech team help with you. Yes, you just did. Okay. Corey, why don't you pick up from there? Dan and Jandel, I think we were opening up the gateway here to maybe dig into the pandemic and, you know, maybe some surprises that we've had around what we thought was maybe going to be unifying and maybe wasn't at times. If we want to go in that conversation, why don't we just go right there? Dan, do you want to kind of pick up on that thread, and then Jandel, you can maybe chime in too. And Corey, let us know if you're back with us.
Well, I'm somewhat reluctant to start off, since Jandel is a should we say, he's in the trenches and sees things that I, in my lofty academic perch, cannot experience directly. But I guess one thing that seems very notable to me and makes it difficult to manage, apart from the questions of kind of political divisiveness in the country, are the simultaneous questions of significant uncertainties about what to do, and in terms of COVID and the debates. I mean, you see this playing out. Say, consider the different approaches that different countries have taken. Just look at, say, Norway versus Sweden, who have taken very different approaches to dealing with COVID. It shows that the decisions are not simply decisions dictated by science. They're also determined by politics and values and preferences and interests. And so the question of how you balance what you know or what you think you know versus considerable uncertainties versus value trade-offs in a society that is politically pretty polarized, I think gets to the heart of the challenge of why it's been so difficult to really kind of craft a national response here. But I'd be really interested to hear from Jandel about what that feels like when you're actually in the trenches trying to save people's lives.
You know, the interesting thing, and it's not the first time in my career that I've said this, is that what I think we're witnessing, and it obviously has deadly consequences, is a clash between science and politics, and actually even politics and policy yet again, in terms of what really makes sense in terms of how to manage through this. You know, it's funny, Dan, I go back to basics around how do we find ourselves here, and especially when you think about the fact that there's something relatively, and it's all relatively, pure about science and sort of this sense of scientific methods, and sort of this thought, well, if we just scream the science loudly enough, surely people will get it. And what I mean by going back to the basics is we've lost over time the ability to take or discern or observe any one of a number of happenings and critically think about them and make sort of independent judgments about them. And I think some of that is based in tribalism, which is part of the sort of, we could call it innately how we are wired as humans, but also it drives some of the politics behind something that is so apparently a universally shared and experienced a phenomenon, that is this pandemic. And what people lack, and what I think we lack, is any sort of a heuristic or some way of being able to then take the dizzying amount of stuff that's coming at us and interpret it. So one of the things I found myself thinking about is totally off topic for the moment, although vaccines are going to be coming up here real soon, is what the U.S. Preventive Services Task Force did in an effort to help us understand the dizzying array of all the preventive measures that are out there that we have to take. Like when, age appropriate, gender appropriate, when do you take them, when don't you take them, or use them. And what they did is they came up with a way of us being able to assess that dizzying amount of information as individuals. But you have to know that it's out there. And the U.S. Preventive Services Task Force they have A, B, C, D recommendations on any of a number of screening and other preventive services that are out there for us to take, as well as they have even a category I where it's inconclusive or insufficient evidence to make a decision. That would be one help, because I think what we all are looking for in some ways is some way to frame, some way to sense make what's coming at us at any given time. And it's not to say then I can ignore what's coming at me politically, but it gives me agency that we don't have right now because people don't have the sort of sense of science. And so what's happening on the ground, and I see the same news that you do, the emotion that's of caregivers, of healthcare providers who are begging people to take this seriously because of what they're seeing. I've also seen the news. I know last week, apparently, there was a viral tweet from a nurse up, and I do believe one of the Dakotas, of some of the experiences she had with that just sort of demonstrate the power of, in some ways, the bully pulpit to just bowl over science. Surely this isn't COVID, because this is someone who doesn't believe in COVID. And as they're dying, don't call my family because I will be able to, I'm going to get over this. Or the one that she said that was just the most amazing to me was, could this be lung cancer? Could it be anything other than what is apparent based on, a diagnosis and clinically what we're seeing? And so I think that why we're in the space in terms of this polarization around a disease that, as I said, is so obvious what it is, and we're learning more and more about how it behaves, it is because of the ability of what people want. It has nothing to do with science or with the rigor of that. It has to do with who people believe and who people want to trust and who they don't. And we've got to ask ourselves, how do we find ourselves as healthcare in this space? At the same time, I will tell you that I am blessed to work alongside colleagues here at Craig Hospital, let alone across many hospital systems here in Colorado. In fact, I'd say all of them, where we take this pretty seriously. We don't have non-believers caring for those of us who sadly have to walk through the walls to be cared for. So it's another one of those chapters we'll write about in many years. You could take it out of science completely and, sort of think about the other sorts of myths that we've been able, or misinformation we've been able to spin about any one of a number of historical events that have happened that then spawn conspiracies and all the other sort of things that we see happen in the world.
Jandel, can I add another dimension to this? Because I feel like, so, we can say there's science, and then there's the people really on the margins who are saying, oh, the COVID doesn't exist, or I don't believe it, or whatever. But there's a lot in between those two things, right? So, for example, I mentioned the difference between Sweden and Norway, but it's not that the scientists are all one happy family saying this is what we must do and this is what we understand, right? There's lots of disagreement there about many important things that are still to be worked out. And they, within the scientific community, you see this kind of tribalism as well. Just consider the incredible controversy that's emerged around this document called the Great Barrington Declaration. Now, the Great Barrington Declaration has authors on it who cannot be dismissed as know-nothings. They're leading scientists at Stanford and Oxford and Harvard and other places, and it's been signed by many, many doctors. And yet others in the healthcare field have criticized it as being profoundly unethical because it takes essentially a herd immunity approach. It suggests that certain communities like mine, I'm old, can be protected, but everyone else should be, but others should be allowed to return to normal because the economic costs are actually greater than the benefits in terms of strict lockdowns. Now, the point I want to make is not in defense of the Great Barrington Declaration, but in acknowledgement that science doesn't speak with one voice when it comes to the politically divisive, but also scientifically complicated issues. And so I think it's hard to see what's really going on when we caricature those who don't believe in science as one small group of kind of marginal people who I agree are having a very deleterious effect on the dialogue and on people's beliefs, without also talking about how the science is not this pure thing. It's actually right in the middle of the politics, and the scientists are right in the middle of it too.
Right. Thank you for pointing that out. And in fact, it's another, there's this tendency, I say all the time, life is lived in the gray. And it's another way that we're trying to be binary, either or about this. Either you believe or you don't believe. And I think it's extra complicated when it's something novel, when it's, when we're experiencing something we haven't before. And what we end up doing, because we all want models, is you apply models that may or may not be the best model to apply to a phenomenon. So take what you said about herd immunity, sort of the allowing natural herd immunity. My understanding is we haven't, the concept of herd immunity is really one that's talked about in the context of vaccines. It's not this idea of let it run rampant and just do what it wants to do. And then eventually we'll get to whatever this magical 70-75% is. You can do it, but we shouldn't be sort of confusing, again, these two concepts, because they're one applied to this whole notion of how you actually get enough immunized folks in order to protect the entire herd, in our case, humans in this one. And the other would be, just as I said, to let it run rampant. And there's always disagreement in the scientific community, especially with new stuff. But I think where we've gone ever so sideways, and again, I think it's where politics, perhaps policy, because they do vary from country to country, heck, they vary from state to state and community to community, have had another clash, is that we watched the science change over time as we learned more and more about it, but we didn't draw connections, right? We weren't clear, we being either the scientific community or the leadership locally or nationally have not been clear about, we knew what we knew at the beginning. And this is what we've learned as we've gone along to help bring people along the story and the evolution, in this particular case, of where we find ourselves today. And actually, I think it's something that just in general, from the perspective of science isn't very good at doing, is whether it's, I got to get myself back into my own computer now, whether it's this particular thing or this novel coronavirus, or just what we've thought about leeches, right? Which went and then came and went, and in some way they're still used today. Or things evolve, and we don't track the story well enough. And that's why one of I truly believe this context is so important, and we won't slow down long enough to establish it, to bring communities and people along to sort of where our thinking is.
No, I think this is a critically important point, and I agree that I think the science community and the voice of science has done a very poor job managing expectations about what it can do and when it can do it. I think somehow scientists, science advocates, the notion of science as something out there still very much kind of follows the kind of physics model of things, that it's all about causal relationships that can be predicted and natural laws. And in these domains like a pandemic, where we're learning as we're doing, where there's as much knowledge being created in hospitals that are figuring out how to deal with patients with a new disease for the first time on ventilators, for example, as in the laboratories. This process of untangling our understanding as we grapple with what to do is something that we're not set up to do, and we don't even have good ways of talking about it. And I actually think it's we're often rather we in the scientific community are often rather dismissive of the public's justifiable confusion, things that were said as early on, don't touch your face, right?
Yeah,
things that were said early on that, or don't, surfaces are dangerous. So it's fine to have not gotten things right, and it's especially fine to be cautious early on in the absence of certain information. But it's also hard to maintain your legitimacy when you want to claim both that we're the source of authoritative knowledge and, oh, by the way, that this knowledge is uncertain. And then when you mix that with politics, because you have, there's nothing wrong with this. This is actually unavoidable, because you have to make choices. Who's going to bear the costs of action? There's going to be grave economic costs. What's worth doing and what's not worth doing? Those are inherently political. And when you mix that with the uncertainties in the science, and you mix that with a very tribally divided country, it's pretty hard for science to maintain anything like its reputation for distance, for purity, for objectivity. It's really difficult to unwrap those things. And I feel like the scientific community doesn't do itself any favors when it doesn't acknowledge those difficulties.
Yeah, you know what's funny about this? You just you made me think, Dan, back to the beginning of the pandemic, and who would have ever thought that I'd find myself getting to do this kind of work during the pandemic? Because I'm only 2 years into this new role, although I've been in medicine for 40.
Boy, you were really thrown in the fire, huh?
Yeah, great timing. But what I do remember at the beginning was taking a walk one Saturday morning. It was like really a week into our incident command, and we're trying to make these decisions about how do you manage, what are we going to do with work from home, with employees, and and touching surfaces and all the other things we were thinking about. And I said, boy, how do you make this? How do we do this? And it hit me. And I think what might be a way to bridge the politics, because they are, and even good or not so grand policy, because it is, as well as the science, which is evolving, is through a values lens. And if we could get to a place of what are the shared values that we're gonna push every decision, not down to the nitty gritty, whether you touch surfaces or not, but the big ones around how we're going to manage our finances through this, how we're going to manage the economy at a macro level, how are we going to deal with work from home employees, how are we going to deal with what's happened economically, so you can sort of take it from this micro level, Craig Hospital or any place like that, to the macro. And I said, it hit me. I said, Jandel, it's values. And we came up with 5 that we've used to help us work through this. While I was out walking, I said it's about safety. And safety has to be first. I mean, in the case of a hospital like the one we have, where we take care of these incredibly vulnerable patients with spinal cord and brain injury, safety has to come first, but also safety of our workforce, because we need them here to continue to care for people. The second one was equity, and really equity was about all and only what is needed in order for us to really solve problems, or in the case of when you think sort of at a macro level, to continue to function to the best we can during that time. Fairness, and fairness is something that we don't like to talk much about, but the way I framed it was everybody takes a haircut. Everybody's going to have to feel some shared pain in this, because there's no way around it. The fourth was trust, which was that we were going to be honest. And the only information we were not going to share is that stuff which we are legally prohibited from sharing, or where if you stop for a few minutes and think about it, you will step in big doo if you share that with people in a way or share it too soon. And then the final was sustainability. And when I thought about sustainability, I thought about it through the lens of our emotional and social well-being, our physical well-being, as well as, frankly, our business interest. So as we take those 5, and in the early parts of this, we even created statements around how those 5 apply to how we're going to manage workforce issues, how we were going to manage our expenses through a time like this, how we were going to think about our work from home crew, how we were going to think about our families and our caregivers, and how we reintroduce them into the environment. So, your comment made me think maybe that's what's missing. In that way, is there the opportunity through looking at our interest around what are some shared values, we could begin to pull all of them together.
So this is really powerful. This is really powerful, Jandel, because what you're talking about is something that you could manage in an institution that, you can tell me if this isn't right, but I suspect it is. Pretty much everyone in your institution, that is your hospital, has a common interest in protecting, advancing, restoring the health of the patients that you deal with. And and I think the articulation of this set of values is fantastic. But we have a scale problem, right? Yeah. Because how do you then ramp that up on a national level or even a state level, where you have diversities of institutions, diversities of values, and a lot of distrust that makes it really tough to talk about what are the values at stake. But nonetheless, I think it's a key point because, and I think this is where we get into trouble with science a lot. We ask science to do the job that politics should do around establishing what the key values are and how people feel about them and how they want to balance between them. And when we make statements, often politicians do this quite maybe understandably. They'll often say, well, the science says I must do this. But what they really mean is, I'm using the science so that I don't have to say what the values at stake are, because it has more legitimacy if I can mobilize the science on my behalf. You saw this going on around the debates over masks and around the debates over hydroxychloroquine and so on. And so the question of how, and you may disagree with this, I'd be interested to know, I think we need to roll back the science and put the values up front at this higher level and be really clear about what's at stake. Be really clear about what's at stake. And then once we're clear about that, it becomes more apparent why people take the positions they take, okay? And so I think, using this kind of exercise you did in your group as a model, how can we scale up that kind of approach, especially in a political time where there's so much distrust? It's a big challenge, but I think it's where we need to go.
What's interesting is this whole notion of, and you're making me rethink what we've heard for too many months in a row, which has also been politicized. Either are we hiding behind, or are we looking for the holy grail in science because there's just so much clutter out there and so much noise? But what we've done is we've made politics bad, policy bad, science good. And the fact is, and what I've watched play out on a micro level here at Craig when I step back is, for months we've been meeting in incident command. I mean, at the very beginning of this, we set one up, and we have 3. Well, our amazing infection control nurse got stolen by the state to do the work. She's just so damn good at what she does. But 3 nurses. We had infection control, we had our safety manager, and our occupational health and safety. They're the core. And then all of us executives, as well as the physician leads in the hospital, we've been meeting, and we all had to make our way. We had to sense make. There's no playbook for this, for how you do it. But the other thing that goes alongside those values is what's required is the idea of understanding and getting very clear about role clarity. 2 things. There is a lane that you should stay in, and you don't stay in the lane all at the same time. It's this crazy thing where you got to live in 2 heads at the same time. So here I am, a physician leading this hospital, got to think about the business sides of things and the care and the quality and the safety and the social and emotional well-being of our patients, family members, as well as our teams. And we also must respect expertise. And that's what I think we've also lost, is this ability, anybody with a bullhorn's an expert anymore. And I don't think that science, it's going to be kind of I love this conversation. I can't wait to think about it at 2:30 this morning, because one of the other things that, where I think we have not helped ourselves in science, and I have accountability for research here, reports directly into this office, but I also had it at Kaiser Permanente where I was before. And the interesting thing about research is there's this research cycle that we have a chance, and I think if we're going to learn anything from COVID, that perhaps now we can get translation done. And what I mean by that is, so here's the cycle. You have a question. You form that question to something that's really worth some scientific inquiry. You figure out the methods that you want to use in terms of approaching both the setting up, how you're going to answer the question and how you're going to now analyze it statistically using the right data. You apply for a grant to somebody. Look, hopefully you'll get one. You get the grant, you do the research, you figure out the findings, you publish the findings, and then it's called rinse and repeat. Rinse and repeat. There's not a place there where, I was thinking earlier when I was thinking about this, there should be an off-ramp there. No, it's not an off-ramp. The thing that we need to put into the cycle is then that information has got to get embedded, and it's the scientists and the scientific community's responsibility to shout from the highest mountain what we're learning, and also then do some evaluation. At least that's how we talk about it in healthcare, because research in a very simplistic way answers what works or what is. And then evaluation, it says what works in my population, or how does it play out on the real stage. And that's what's missing. And so then scientists are not necessarily rewarded for that last piece, because that's not where the money is. That's not how that particular engine works. And I think if we can use this opportunity with COVID, where we've got multiple populations, it's playing out on a grand stage. We're seeing the demographic and the epidemiologic differences. We're seeing how social factors and social context impacts the manifestation of the disease in communities. If we can get away from politics and policy are bad and science is good, to say, let's bring our expertise here together in terms of playing our role, and then together getting out of our lane and coming up with the right answers. Now, and the fascinating thing here to date, because of, I am in awe and so humbled to get to work alongside this team. We have had no COVID in any of our patients. And 800, 600 of us are coming and going every day out into the community and coming into this place. I mean, it's really like it's not magic. I think there may be there's probably some prayer in there for sure, but it's a different kind of flattening of hierarchies and respecting the expertise and what people bring to that big old table to help us make decisions. And it's also listening to the folks on the ground around how things are playing out. So if you take that at a macro level, people should be listening to these doctors crying on TV from ERs and from ICUs. And we should be listening to those who are in small communities who haven't had the disease to the same extent, because it's going to play out differently on the ground. And therefore, they get categorized as non-believers, but they may not be. We need to listen to the businesses that are literally destroyed. And we need to listen to and look at these long lines of people who are hungry right now. And this is really,
I think a really interesting dimension of what you're saying is that expertise, the stay in your lane thing is really interesting, right? Because expertise is very significantly distributed. And I think too often we have designated experts. You're a scientist, therefore you're an expert. But as we see, for example, around this debate around the Great Barrington Declaration, when you begin to move from your particular expertise, which might be, say, economic modeling of the effects of a lockdown, to policy, oh, we should do this or we shouldn't do that, you're no longer necessarily staying in your lane. It's not to say that you shouldn't have opinions about that, but your opinions are going to be influenced by things like your values, your political preferences, your understanding of the world. So, and this point about context, I think, is absolutely essential and often neglected, right? Because I think we have this notion of science as this thing that provides us generalized information, but the whole nature of medicine is to address the particular context of the particular patient, which takes things like judgment and experience and empathy. So it's a much more complicated mix. And I love your point about not demonizing politics. I mean, I understand why one might want to demonize politics, but if you think about politics as the expression and adjudication of values, which can often bring a lot of strong emotions in, it's something that humans have to do to survive. And the demonization of politics, which is often done by politicians, ironically enough, but also scientists, takes us farther away from that crucial component of what we have to do that you managed to do so beautifully in your institution. So there really is this sense of how do we bring science and politics, I think, actually closer together, not farther apart, so that we can take what's strong and valuable about each to inform one another, rather than the sense of science speaking from Mount Olympus to the great unwashed who then listen. It's really tough. And the question of expertise is a really tough part of that, because which experts get to count for which particular discussions? As you say, in a rural town that hasn't yet seen the disease, there's a kind of expertise. In a small business that's had to fire half of their employees, there's a kind of expertise. All of these count in the conversation.
Yeah, it's that phrase, I think Don Sarewitz said, every system is perfectly designed to achieve the results it achieves. And some of what we've done is we don't step back. Your comment earlier about stepping back, what people need in times of this kind of ambiguity is sense makers. And when you're lost in a forest like this, any map will do. And that's what we know. And so let's make good ones. And you can't make good ones unless you think in systems. Corey.
I think that's
I was briefly absent, and that's one of the frustrations of this kind of communication. But I have been listening. I have caught up to speed with the conversation. And before we run out of time, I wanted to go back to something that we addressed earlier in conversation among ourselves, and that's the whole question of equity and trust, racial equity and trust, minority equity and trust. Black and Latinx people and other minority people have expressed, for one thing, they've been hardest hit by COVID-19, and for another, this has all highlighted the inequities in the health system, but inequities in so many of our other systems too. The justice system, the whole Black Lives Matter movement, protests against the way people are treated by the police. And Black leaders especially have said, that they have very little reason to trust these judicial and law enforcement systems. And that seems to extend to the medical system as well, particularly as concerns vaccines and treatments. So, Jandel, maybe you could start by addressing what we can learn from that.
Well, I think there's a ton we can learn. It's really, do we have the will to learn and really look in the eyes? Frankly, also looking back historically at why there would be such mistrust on the parts of marginalized communities, people of color, people with disabilities, and so forth. And I think, as you said, the judicial, certainly we have no trust in that. And we've gotten to watch, sadly, this play out time and again, some of the reasons why. At the same time, because context matters, nobody provides denominators. And so now we've demonized police, right? And it's not every life lost. Please don't hear, listen, I'm an African-American woman and I have a Black son. So and a Black daughter, and I worry for them. I worry for them constantly around these issues. So I am not letting police off the hook or the judicial system off the hook in this way. But there's also less trust in the healthcare system for some very valid reasons. Look what we did with Tuskegee. I mean, when I think about that, ended in the 70s. Holy cow. we were alive when that ended. You would have thought that was something that happened in some dark age. When you think about the fact that most poor people get their care in big university hospitals, which means a fair amount of the research and the big findings that we've, the big things that we've landed over time, we've not been necessarily the beneficiaries of. The saddest of which, and the most obvious story, in at least my history, is the fact that Charles Drew discovered plasma and blood transfusions and died at a car accident because he was not able to get a transfusion because we couldn't put white blood in a black man. I mean, you think about these sorts of things and you wonder why there's mistrust. But even beyond all those sort of scientific things, it's how we're treated when we come into the system. And so this has little to do with science and everything to do with work that we as a healthcare system have to do around dealing with implicit and frankly explicit bias in order to do it. But then add to that, that if we think in this conversation we've been having this last hour or last 40 minutes or so around the dizzying array of information that's coming at us from all sorts of different places that's hard to really cut through and figure out the myths, the dis, and the real information in that, or credible information in that. If we think it's bad in the general society, trust me, it's worse in my community. It is so difficult to access good information or to have even access to good information. And so there are beliefs that HIV was put in the Black community by, for example, by healthcare. And those things have this way, just like all other sorts of misinformation, of becoming viral and becoming the stuff of lore in a community until or unless there's the opportunity for, back to where this whole conversation started, is this notion of trust and how do we rebuild trust within the systems. In my view, you build.
How's that playing out in terms of acceptance of a potential vaccine?
I would say not well. And I actually remember early on, I had to, I'm just going to say right here in front of all of God and man, I suppose, and women, that early on I was doing this goes back to May, when I did a panel for a discussion with the African leadership group here in town, and said, at the time it was like, we're going to have a vaccine by September. And I said, if there's a vaccine by September, I'd be incredibly mindful of whether you take it or not. And then I went back because I worried. I did not want to be the person who said, that Black woman said, don't take the vaccine. And I went back to the leaders and said, it is not that I don't think that people should take vaccines. It's that anything that's created that quickly has the opportunity, especially if we try to roll it out, which was politics, that quickly, that we're going to be, we run a strong risk of harming people. But of course, and this is where I think science so far is ruling the day, is that folks are holding their ground and standing by good scientific methods around it. So I think in the end we'll be able to. There was an earlier discussion, one of the earlier panels, is that the way that it's going to be best received and therefore best accepted by the community is the trusted brokers within the community have to be the ones who carry the water. It can't be, the Johns Hopkins guy or girl in their white coat coming in, even me, and that includes me, right? As a healthcare provider in this case, who would come in and say, trust us, it's safe, unless I'm viewed as a trusted broker in the community, which means, back to the adaptive challenge that we're facing around this stuff, is that the people who are going to be best able to help us solve this problem are the people who have the problem. And we need our community to be at the table helping figure out how to distribute this thing within communities as we get, further down after this, the emergency use authorization sort of period, and it gets into sort of mainstream use. So that's what I'd say is going to have to happen.
What we talked about before we came on was the whole issue of how misinformation and disinformation plays into this. As you said, we're in a media environment or an information environment where we're just constantly bombarded with messages. And maybe I'll turn to Dan for this. What have we learned, or what can we learn about how disinformation or misinformation or the kind of thing that everybody is bombarded with? What can we learn about how to control that, how to help people how to help people evaluate that.
Well, one thing we can learn is we're not going in the right direction. So the first thing I want to say, to make clear, is misinformation and disinformation is a real problem. It's being consciously thrown into the system by everyone from Russian trolls, troll farms, to mischievous and worse actors in the domestic scene. But I really believe it is it's a symptom, not the fundamental thing that we need to be worried about. For one thing, misinformation and disinformation is nothing new. Think about the Gulf of Tonkin incident, which launched the Vietnam War. It was made up. Those sorts of things go way back. So that in itself isn't new. But what is new? What's new is the infinite access that everyone has to any information that they want to get and construct in any way that meets their worldview. So a combination of social media and the internet, and even I would say Google Scholar, if you want to find peer-reviewed articles that say what you want to say, you will be able to find them. Makes it possible for everyone to construct what they see as the world that conforms to the way they believe the world to be. This is really tough. And so in the absence of institutions that can offer some kind of trusted, say, vetting of information, it used to be a few newspapers that were seen as trusted authorities. They're no longer seen that way. And I think that's become a self-fulfilling prophecy. I don't know how you feel about it, Corey, but I'm a longtime New York Times reader, but I'm rather disgusted with their, what I'd say is the dissolution of the boundary between editorial and journalistic in that newspaper. So we're seeing this everywhere. So I think serious attention needs to be given to whether and how it's possible to create something that everyone can view as a kind of trusted mediator, because the way the technology is pushing us makes it incredibly difficult and we all do this. I don't think anyone is exempt from this, from going out there and finding the versions of reality that we want that make it easier for us to kind of make sense of the world and feel less crazy amidst all the incoherence. So there's a very, I think just focusing on trying to get rid of misinformation and disinformation probably can't succeed. I think instead we need to really think about what are the underlying technological and institutional factors that make it so easy to find any information that you want, and make it so easy for mischievous purveyors, but also people who disagree about substantive issues to get their ideas out there in a way that makes it impossible for the average citizen, and I include all of us as that, to in most cases know what we can believe and what not to believe.
Yeah, as a media person, I have to say that media is not unlike science in that, it's always developing. It's always meeting new challenges or trying to figure out ways to meet new challenges, and I think in the last few years, and particularly in the Trump years, a lot of the, what I call reality-based media organizations tried to balance themselves out, balance issues out, and wound up creating a sort of false equivalence between things that are true and things that are patently not true. And then big media organizations tried to come back and speak the truth as they saw it, and I think that led to the erosion of the editorial versus news sides of these news organizations. I don't know, how do you see it, Jandel?
I'd say what Dan said, if that makes sense. The one thing I think that I would add to this, and it was only in thinking about the question, is that I think this notion of what's going to be required of media, let alone of science and others, is that we've got to have science, as I said, needs to have a much bigger bullhorn in the right way. All the caveats that we've talked about notwithstanding, than some of the others. I think we have not invested time, talent, and treasure in assuring that there is a credible journalistic presence across the world, let alone in the, I mean, there are schools of journalism that closed. I mean, what's that about? And I think, just like I was saying, that science needs to own their part in this, in terms of why the science is so messy. I think the media, and we know this, God, we've been talking about this forever, needs to own its part to it. The other part of this that maybe a little off topic, but I think spot on, is that, just as I said, what scientists, researchers are paid for is getting the grants and writing the papers, not actually translating the research into something that is useful and usable. The same could be said, what's the equivalent in media? It's about advertising, right? And it's not necessarily about, making sure what sells and in what ways is the media motivated and rewarded and incented to do what it does. It's more eyeballs on, which is all about media. I mean, it's all about advertising, which is about dollars. And so another messy topic that we could go down a long, very dark tunnel on. So that's what I'd say. And I think,
let's
anyway.
from the dark tunnel here, and because we're coming to a close, and I wanted to hear from each of you, the sort of things you see as hopeful signs.
Yeah.
Dan?
Yeah, sure. So, in fact, I wanted to kind of add on to Jandel's initial discussion about the vaccine and her initial totally appropriately cautionary message that if it happens too fast, we should worry about it. We haven't talked about technology, and in the right context, I think technology is an incredibly powerful force for getting people on the same page. And so if we have a vaccine, which is a technology that is reliable, that is safe, and that people can see works, I think that's going to be a really hopeful development, not just because it's going to hold the pandemic at bay and reverse it, but because it will allow people to actually see that we can solve these sorts of problems if we work together in the right ways. They'll see that the regulatory agencies that require appropriate testing work. They'll see that the learning over time works. They'll see that the competition between companies works. They'll see that the relationships between universities, agencies, and the private sector is important. So, and they won't necessarily see that if it's not explained to them, but they'll certainly see the outcomes. So I actually think here that while technology often is a double-edged sword, I'm a huge believer in vaccines as a source of social cohesion. Just very quickly, I'll wind up in 1 minute, Corey. But if you think about childhood vaccines and the way they bring together educational institutions, the insurance companies, the pharmaceutical government, all these groups that normally hate each other, they collaborate to make sure that all kids get vaccines to protect them from diseases that could kill them. There are some exceptions, but mostly that works. So I think that's a kind of model that I actually feel quite hopeful about
before
here,
we wrap
and
up,
it really reinforces Jandel's point about let's get that right.
Oh, what was that, Corey? Oh, you want me to jump in?
Jandel?
So I have more basic sorts of silver linings to these clouds I think families are connecting to old relatives in ways they didn't. That's where this technology is very helpful. I mean, people are slowing down enough to actually see each other because there's not much more to do except see each other. It has its dark side, we know, in terms of some of our concerns about childhood hunger and domestic violence. So I'm not in abuse, but I think we're talking silver linings. I think that, interestingly, humanity's desire to be connected supersedes everything else. And so there is more reaching out and more touching base, whether it's texting or spending time on phones or on these sorts of platforms. Within organizations, we're using these. I mean, gosh, overnight, I figured out a way to talk to 1,000 people more than once a year in the gym. The telecommuting economy, it's a real thing, and we're going to have to get on the other side of this and figure out what it is. I think we know that greenhouse gases are falling.
I'm going to interrupt you, Jandel, so that I can have time to say thank you to the Institute for Science and Policy and to Kristen, and hand it back to Kristen.
Great. Thanks, Corey. We have just a couple minutes, so actually I am totally good. I know, Corey, you are on a slight delay. I want to make sure you have a closing word as well, too. But Jandel, why don't you go ahead and finish that thought on greenhouse gas emissions and where you are headed with that final thought? And then, Corey, why don't you take the last word, and then I'll take it back over.
Well, and I will be incredibly quick. There is less traffic congestion, therefore we aren't polluting the air as much, which is a great thing in healthcare for those with respiratory conditions and asthma, let alone more serious, and that's serious enough. We're all reimagining bricks and mortar, and I think that's a good thing. You know, smaller footprints that way, which has its downside, but it could have its upside in terms of how we use it. Healthcare has been resistant to going to telehealth, and we got pushed off the cliff overnight into this space, and we will figure it out. We'll figure it out a bit. We're figuring out because we have no choice right now, but we're not going to go back. And I think just the quiet. I wrote down it's just quieter, and that's okay. I mean, I've been hearing such wonderful stories about how people who chose not to be of the 5 million who traveled, how they spent Thanksgiving, and sort of this. I said this morning to someone, it's so cool. We're not trying to recreate what you can't recreate. So we're inventing, and we're finding new ways to be. New emergence is coming, and I'll tell you, in the end of all this, I think science will win. I really do, and I think it's going to take us sort of repositioning where we are in terms of science. And there's a ton we can learn if we spend the time as collectives to reflect on what we're learning and become truly learning communities, learning societies. So, yeah.
Thank you, Jandel. Corey, do you have a silver lining from this year, from this discussion of meeting these two new people that you want to share? Why don't I give you the last word, Corey?
Yeah, mine is very much like Jandel's. I think, the things that we've gotten from this, new ways of communicating, new ways of relating to one another. In my neighborhood, for instance, people wear masks and maintain social distancing, but they tend to stop in the street and talk a lot more. And I think that that's a very healthy sign for our society. So that's my source of hope. And I'd like to close by just thanking the Institute for Science and Policy once more for giving us this opportunity to communicate.
Thank you, Corey. Even sometimes when our communication has little bumps and hurdles along the way, we, as humans, we persevere, right? And we can push on through, and we always are searching for that connection. I just want to emphasize that as well. So thank the three of you so much for joining me in advance to spend some time talking before we even got here today. I was texting with George during this panel, and as you can see coming in the chat here, this was an awesome discussion, and we both agree that we could listen to the three of you all converse and have a conversation all day. So if you just want to stay on, we'll just sit here and listen. It's been a great pleasure having you. Thank you very much for your time and for your insights. And I hope you enjoy the rest of your week. Feel free to join us back here on Thursday. We've got one more session coming up. So if you've got time or want to stay in, it's going to be a really exciting closing keynote for the day where we're going to talk about COVID and climate. So let me thank my current panel and see if we can get our next guest on here. So thank you.
Thanks. Bye-bye. Great
Thanks,
to meet
Kristen.
you.